Hello everybody, I'm Dr. Vahini Reddy and I have my private practice called the Dental Venue in Koramangala, Bangalore, India. Which toothbrush should you use? This is a question that is frequently asked both in and out of the dental office. I personally recommend that you use a toothbrush with soft bristles. Medium and hard bristles wear down the enamel on your teeth, causing tooth sensitivity. Use gentle pressure while brushing, at least twice a day for sure, for at least 2 minutes at a time. Powered and manual toothbrushes do the job efficiently. Powered toothbrushes are especially recommended for individuals with slightly compromised motor skills. Manual toothbrushes with bristles of varying heights or angle bristles do the job just as well. Do remember to discard your toothbrush every 3 to 4 months or even sooner if you've just recovered from a flu or a throat infection. Toothbrushes that have bristles that are flayed or bent don't do an efficient job of removing the plaque completely. If your bristles look splayed or bent, do discard it immediately as they are no longer effective in removing plaque. If you notice your bristles getting bent much sooner than 3 months, this may indicate that you are following abnormal brushing techniques or applying an undue amount of pressure. At the end of the day, the brushing technique is much more important than the kind of toothbrush or toothpaste you use. Do remember to ask your dental professional for a demonstration of the same, or you could probably wait for my future videos.